Question 1. In the context of pediatric CT imaging, what is the most important factor to consider when determining the appropriate imaging protocol? A. The patient's age and weight. B. The clinical indication for the scan. C. The imaging facility's standard protocol for CT imaging. D. The type of CT machine available at the facility. Answer. Correct answer. B. The clinical indication for the scan. Explanation. In pediatric imaging, the clinical indication is paramount in determining the appropriate protocol. The ALARA, as low as reasonably achievable, principle must guide all pediatric imaging decisions to minimize radiation exposure while still ensuring diagnostic efficacy. Clinical indication ensures that only necessary scans are performed and unnecessary radiation exposure avoided. Option A is important for dose adjustments, but without a valid clinical reason, imaging should not be performed. Option C and D are important but are secondary considerations. The protocol should always be tailored to the clinical need. Question 2. When considering the image gently pledge, which of the following is a core component that radiology professionals should actively practice? A. Always use the highest possible dose to ensure the best quality image. B. Ensure the use of sedation in all pediatric imaging procedures. C. Prioritize the minimization of radiation exposure in pediatric imaging. D. Select the imaging modality based on convenience rather than clinical necessity. Answer. Correct answer. C. Prioritize the minimization of radiation exposure in pediatric imaging. Explanation. The image gently pledge emphasizes the importance of reducing radiation exposure in pediatric patients to protect against long-term health risks. This is consistent with the ALARA principle, which advises using the lowest possible radiation dose necessary for achieving diagnostic image quality. Option A contradicts the principles of radiation safety, while B and D. Focus on non-essential aspects like sedation or convenience, which are secondary to radiation dose optimization. Question 3. Given the circumstances that Mr. Thompson, a radiology technician, is performing a scan on a child, what should he do to ensure the radiation dose is minimized? A. Increase the milliamps to improve image quality. B. Use a pediatric-specific imaging protocol with lower kVp and MAR. C. Perform the scan without considering the child's size or age. D. Avoid using any shielding during the scan. Answer. Correct answer. B. Use a pediatric-specific imaging protocol with lower kVp and MAR. Explanation. Pediatric-specific protocols are designed to balance the need for image quality with the importance of minimizing radiation exposure. Lower kVp are typically used for children due to their smaller size and increased radiosensitivity. Option A increases the radiation dose unnecessarily, and C disregards the critical importance of adapting imaging protocols based on the patient. Option D is incorrect, as shielding should be used when applicable to protect radiosensitive organs. Question 4. What would happen if the ALARA principle were not applied during pediatric imaging procedures? A. Radiation dose would remain unchanged and image quality would improve. B. The risk of radiation-induced harm to children would increase significantly. C. Only adults would be at risk from unnecessary radiation exposure. D. The image quality would significantly degrade, requiring retakes. Answer. Correct answer. B. The risk of radiation-induced harm to children would increase significantly. Explanation. The ALARA principle aims to minimize unnecessary radiation exposure while achieving sufficient image quality. If not applied, children, due to their increased radiosensitivity, would be at higher risk for long-term radiation effects, such as cancer or developmental issues. This is particularly important because children have long expectancy during which radiation-induced effects may manifest. Option A is inaccurate because higher doses do not necessarily improve image quality, while option C is incorrect as children are more susceptible to radiation. Option D is unrelated to the principle's purpose. Question 5. In the absence of a clear clinical indication for a pediatric imaging procedure, what should the radiologic technologist do? A. Proceed with the imaging as planned to avoid delaying the procedure. B. Consult with the referring physician to determine the necessity of the exam. C. Perform the imaging using the lowest possible dose available. D. Skip the procedure and document that it was unnecessary. Answer. Correct answer. B. Consult with the referring physician to determine the necessity of the exam. Explanation. Before proceeding with any imaging procedure, particularly in pediatric cases, it is crucial to confirm the clinical indication. The ALARA principle dictates that imaging should only be done when absolutely necessary. In the absence of a clear reason, the technologist should consult with the referring physician to ensure that the scan is justified and appropriate. Option A is not acceptable as unnecessary imaging should not be performed. Option C and D fail to address the core issue of ensuring clinical justification. Question 6. What is the primary reason for using collimation during pediatric radiography? A. To reduce the amount of radiation exposure to adjacent tissues. B. To reduce the total time required for the imaging procedure. C. To increase the resolution of the image. D. To ensure that the radiation dose is uniformly distributed across the body. Answer. Correct answer A. To reduce the amount of radiation exposure to adjacent tissues. Explanation. Collimation is essential in limiting the radiation exposure to only the area of interest, thereby reducing unnecessary exposure to surrounding tissues. This is particularly important in pediatric patients who are more sensitive to radiation. Option B and D are not the primary goals of collimation, while option C is incorrect as collimation does not necessarily affect image resolution. Question 7. According to the Image Gently campaign, which of the following best describes the approach to pediatric imaging? A. Utilizing adult imaging protocols with adjusted settings for children. B. Selecting imaging techniques based on the convenience of the imaging department. C. Tailoring imaging techniques to ensure that radiation exposure is kept to a minimum for children. D. Choosing the most advanced imaging technology, regardless of radiation concerns. Answer. Correct answer. C. Tailoring imaging techniques to ensure that radiation exposure is kept to a minimum for children. Explanation. The Image Gently campaign emphasizes the importance of tailoring imaging protocols for children to minimize radiation exposure while maintaining diagnostic quality. This involves using low doses and adjusting protocols to the child's size and age. Option A does not fully account for the differences between adults and children in terms of radiation sensitivity. Options B and D prioritize convenience or advanced technology over radiation safety. Question 8. In terms of CT image formation and radiation dose, which of the following is true for pediatric patients? A. Higher KVP should always be used to improve image quality. B. Increased mass milliamps can be used to ensure high-quality images in children. C. Lowering the KVP and mass helps to reduce the radiation dose in pediatric CT scans. D. Pediatric patients can be imaged using the same settings as adults without adjustment. Answer. Correct answer. C. Lowering the KVP and mass helps to reduce the radiation dose in pediatric CT scans. Explanation. For pediatric CT imaging, lower KVP and mass are used to reduce radiation exposure as children are more sensitive to radiation. This adjustment ensures that the image quality is adequate for diagnostic purposes while minimizing the risk of radiation-induced harm. Option A and B increase radiation dose unnecessarily, and option D does not take into account the differences in radiosensitivity between adults and children. Question 9. During a pediatric fluoroscopy procedure, what technique is most effective in reducing radiation exposure? A. Increase the fluoroscopy time to ensure thorough examination. B. Use pulsed fluoroscopy or low-dose modes. C. Keep the image intensifier as far from the patient as possible. D. Perform the procedure without collimation to ensure a wider field of view. Answer. Correct answer. B. Use pulsed fluoroscopy or low-dose modes. Explanation. Pulsed fluoroscopy or low-dose modes are specifically designed to reduce radiation exposure during fluoroscopy procedures. These techniques allow for real-time imaging while minimizing the radiation dose to the patient. Option A increases radiation exposure unnecessarily, while C and D are incorrect as both distance from the patient and wide field of view do not help reduce radiation exposure in pediatric fluoroscopy. Question 10. Based on recent studies, which of the following is A key factor in managing radiation exposure in pediatric nuclear medicine imaging are using the same radiopharmaceuticals as those used in adult imaging. B. Weight-based or body surface area-based dose calculations for pediatric patients. C. Increasing the radiopharmaceutical activity to ensure clear imaging. D. Using the highest possible dose for better diagnostic clarity. Answer. Correct answer. B. Weight-based or body surface area-based dose calculations for pediatric patients. Explanation. Pediatric nuclear medicine imaging should be based on weight or body surface area to ensure accurate dose calculation. This helps minimize unnecessary radiation exposure while ensuring effective diagnostic results. Option A fails to account for the physiological differences between adults and children, and options C and D increase radiation exposure without justifiable benefit. Question 11. In the context of understanding the fundamental principles of radiation physics in pediatric imaging, Dr. Harrison, a highly experienced radiologist renowned for his methodical approach, has been reviewing recent research focused on the interactions between ionizing radiation and matter. In a case involving a young patient with suspected pulmonary pathology, he diligently re-examined the physics behind X-ray production and image formation. With pediatric patients being particularly sensitive to radiation, Dr. Harrison is intent on maximizing diagnostic clarity while adhering to the ALARA as low as reasonably achievable principle. As he evaluated various interaction mechanisms, he considered how differences in composition and atomic numbers influence image contrast. His goal was to identify the primary interaction responsible for the contrast that differentiates soft tissue from bone in the diagnostic image. Given these considerations, which of the following physical interactions plays the most critical role in creating contrast for pediatric radiography? A. Compton scattering due to its predominant effect on image noise. B. Photoelectric absorption because it produces significant contrast differences between tissues. C. Rayleigh scattering as it significantly enhances image details. D. Pair production since it becomes dominant in the low energy range used for diagnostic imaging. Answer. Correct answer. B. Photoelectric absorption because it produces significant contrast differences between tissues. Explanation. Photoelectric absorption is the dominant mechanism affecting image contrast in diagnostic X-ray imaging, particularly at the lower energies used for pediatric examinations. This interaction is highly dependent on the atomic number of the tissues, which leads to clear differentiation between high-density materials, e.g., bone and soft tissues. Although Compton scattering contributes to overall image formation, its effect is mainly on scatter and noise rather than contrast generation. Rayleigh scattering has minimal impact on diagnostic detail, and pair production does not occur at the energy levels used in pediatric imaging. Mastery of these concepts is essential for properly adjusting imaging parameters while ensuring patient safety per the ALARA principle. Question 12. In the light of recent developments in pediatric imaging practices, Ms. Parker, an adept radiographer at a premier children's hospital, has been assigned to perform chest radiograph on 5-year-old patient presenting with severe respiratory infection, aware of the child's small body habitus and heightened radiosensitivity. Ms. Parker meticulously reviews the child's medical history, consults with the pediatric care team, and ensures that the device is calibrated for pediatric use. She is determined to minimize radiation exposure while preserving diagnostic quality through the use of pediatric-specific exposure factors, careful collimation, and shielding of radiosensitive organs. Additionally, Ms. Parker examines potential adjustments to exposure time and current settings to avoid unnecessary dose escalation. In this scenario, which of the following actions should she implement to optimal safety and diagnostic efficacy in the examination? A. Use standard adult radiographic settings without any modifications. B. Employ pediatric-specific exposure factors, including proper collimation and dose adjustments for the child's size. C. Increase the exposure time to obtain sharper image. D. Utilize full-field imaging to ensure complete anatomical coverage. Answer. Correct answer. B. Employ pediatric-specific exposure factors, including proper collimation and dose adjustments for the child's size. Explanation. Pediatric-specific adjustments, including collimation, reduced exposure factors, and appropriate shielding, are critical for reducing unnecessary radiation exposure in children. Standard adult settings. Option A. or increasing exposure time option C can lead to excessive radiation, while full imaging option D may unnecessarily irradiate non-target areas. This approach aligns with the ALARA principle and the guidelines promoted by the Image Gently campaign to safeguard pediatric patients. Question 13. Amid a particularly busy afternoon at a specialized pediatric imaging center, Esther Davidson, an accomplished CT technologist, is scheduled to conduct a scan on a child who is suspected of having a congenital anomaly. The procedure is inherently challenging due to the need to balance sufficient image quality against the risk of radiation exposure in this radiosensitive population. Esther Davidson begins by reviewing the patient's medical history and the clinical indications for the scan, ensuring that every parameter of the protocol is justified. With the increasing availability of advanced CT technology, his focus turns to several dose optimization strategies that have been recently integrated into pediatric imaging protocols. After considering the benefits and potential drawbacks of each method, Esther Davidson must determine which optimization strategy is most effective in reducing radiation dose while maintaining diagnostic image quality. Which of the following approaches should he choose? A. Increasing the KVP to improve tissue penetration. B. Expanding the number of CT slices to enhance spatial resolution. C. Utilizing iterative reconstruction algorithms to improve image quality at lower radiation doses. D. Eliminating dose modulation to simplify the scanning process. Answer. Correct answer. C. Utilizing iterative reconstruction algorithms to improve image quality at lower radiation doses. Explanation. Iterative reconstruction techniques allow for significant noise reduction, permitting lower radiation doses while still yielding high-quality images. Critical factor in pediatric CT imaging: increasing KVP, option A, or the number of slices, option B, would likely increase the radiation dose. Foregoing dose modulation, option D, removes an essential method of adapting exposure to patient-specific anatomy. This strategy ensures careful balance between patient safety and diagnostic efficacy. Question 14. In a detailed review of pediatric nuclear medicine protocols at a leading children's hospital, MS Williams, an imaging scientist known for a thorough approach, has been tasked with scrutinizing radiopharmaceutical dosing practices. Recognizing that children are more vulnerable to the effects of ionizing radiation and that standard adult dosing could result in overexposure or poor diagnostic images, she has spent considerable time fixed dosing protocols to more individualized methods. MS Williams reviews current guidelines, which emphasize the necessity of personalized dosing strategies based on child's unique body habitus, including weight and body surface area. Her objective is to ensure that each pediatric patient receives the minimum effective dose to achieve diagnostic quality while mitigating potential radiation-induced risks. Given these considerations, which of the following dosing calculation methods is most appropriate? For pediatric nuclear medicine imaging: A. Using fixed radiopharmaceutical doses irrespective of patient size. B. Applying weight-based or body surface area-based calculations to determine the appropriate dose. C. Administering the maximum recommended dose to reduce scan time. D. Estimating doses solely based on the patient's age. Answer. Correct answer. B. Applying weight-based or body surface area-based calculations to determine the appropriate dose. Explanation. Personalized dosing strategies based on weight or body surface area ensure that each child receives the minimal necessary radiopharmaceutical activity while still achieving clear images. Fixed adult doses or age-based estimates do not account for significant variations in pediatric body composition and administer. The maximum dose unnecessarily increases radiation exposure. This individualized approach is essential to adhere to the ALARA principle and current pediatric nuclear medicine guidelines. Question 15. In a high-pressure environment within busy pediatric interventional radiology suite, Esther Lee, veteran fluoroscopy technologist, is preparing to perform series of fluoroscopic procedures on children. Aware that prolonged fluoroscopy can lead to significant cumulative radiation exposure, Esther Lee is committed to employing the most advanced and effective dose reduction strategies. He diligently examines available techniques, including adjustments, exposure time, the use of collimation to restrict the irradiation area, and modifications to fluoroscopy modes. To identify the method that best balances the need for high-quality images with minimal radiation risk, his detailed review of current best practices has led him to consider the impact of pulsed versus continuous fluoroscopy on radiation dose. In this demanding clinical setting, which of the following approaches should Lee adopt? Effectively reduce radiation exposure without compromising the success of the intervention. A. Increasing the pulse rate to capture more images continuously. B. Utilizing continuous fluoroscopy mode to avoid interruptions during the procedure. C. Employing pulsed fluoroscopy techniques along with low-dose modes to minimize exposure. D. Positioning the image intensifier further from the patient to decrease exposure indirectly. Answer. Correct answer. C. Employing pulsed fluoroscopy techniques along with low-dose modes to minimize exposure. Explanation. Pulse fluoroscopy delivers radiation in controlled pulses rather than continuously, dramatically reducing the overall dose. When combined with low-dose settings, this technique ensures that image quality is maintained at safer radiation level. In contrast, increasing the pulse rate, option A, or using continuous fluoroscopy, option, typically increases the dose, and simply altering the position of the image intensifier, option D, is not an established dose reduction method. Question 16. With respect to the transformative impact of digital radiography in pediatric imaging, Mr. Anderson, an innovative department manager at a state-of-the-art pediatric hospital, is reviewing the performance of the facility's recently upgraded digital systems. His primary goal is to leverage the advanced technical capabilities of these systems to reduce radiation exposure while enhancing image quality. Mr. Anderson's in-depth analysis covers detector sensitivity, post-processing features, and the potential for dose reduction during image acquisition, factors that are especially critical for children due to their higher radiosensitivity. The digital radiography platform now allows for significant post-processing adjustments, which means that the initial image can be acquired with considerably lower dose while still achieving diagnostic clarity after enhancement. In light of these technological benefits, which of the following statements best describes how digital radiography improves dose optimization in pediatric patients? A. Digital systems inherently require higher radiation doses compared to film screen methods for high-quality images. B. Digital systems enable extensive post-processing that permits the use of lower acquisition doses without sacrificing diagnostic quality. C. Digital systems offer no significant dose reduction benefits over traditional analog techniques. D. Digital radiography necessitates repeated exposures to achieve acceptable image quality, thereby increasing the overall dose. Answer. Correct answer. B. Digital systems enable extensive post-processing that permits the use of lower acquisition doses without sacrificing diagnostic quality. Explanation. Digital radiography's advanced post-processing capabilities allow images to be optimized after acquisition, enabling the use of lower radiation doses initially. This approach is particularly advantageous for pediatric imaging, where reducing exposure is essential. Options A, C, and D mischaracterize the benefits of digital technology and do not align with established practices to minimize radiation exposure in children. Question 17. According to recent studies on effective patient communication, Ms. Rodriguez, a seasoned pediatric imaging coordinator, is preparing a comprehensive training session for her department. In her role, she faces the significant challenge of translating complex radiation physics and safety protocols into language that is accessible and reassuring to parents and caregivers. Recognizing that heightened public concern about radiation risks might lead to apprehension regarding necessary imaging procedures, Ms. Rodriguez is dedicated to fostering transparent and empathetic communication. Her training session aims to equip staff with strategies to clearly convey the rationale behind imaging decisions, emphasizing both the essential benefits and the minimized risks due to modern dose reduction techniques. In her preparations, she must decide on the most effective method to discuss these issues with concerned families. Which of the following approaches should she advocate for when communicating radiation risks and benefits to parents? A. Emphasize the potential harmful effects of radiation extensively to enforce caution. B. Provide a balanced explanation that includes both the risks and the life-saving benefits of the imaging procedure using simple language and practical analogies. C. Dismiss parents' concerns by stating that the radiation dose is negligible. D. Advise parents to seek independent information rather than relying on the hospital's explanations. Answer. Correct answer. B. Provide a balanced explanation that includes both the risks and the life-saving benefits of the imaging procedure using simple language and practical analogies. Explanation. Balanced, clear explanation helps demystify complex medical concepts and reassures parents by transparently outlining both risks and benefits. This approach supports informed decision-making and builds trust. Overemphasis on risks or dismissal of concerns can lead to misunderstandings and unnecessary anxiety, while deferring responsibility to external sources undermines the credibility of the healthcare team. Question 18. Through the lens of professional collaboration, Kim, the head of a busy radiology department at a major medical center, is actively evaluating ways to enhance interdisciplinary communication regarding radiation safety in pediatric imaging, recognizing that optimal pediatric care requires input from radiologists, technologists, physicists, and referring physicians. He is exploring innovative methods to foster a culture of continuous learning and active dialogue. Kim has observed that regular multidisciplinary case reviews, combined with targeted training sessions, lead to better adherence to protocols such as those outlined by the Image Gently campaign. By sharing experiences and reviewing challenging cases, his team can identify opportunities for further dose reduction and process improvements. In this environment, which approach would most effectively promote multidisciplinary communication and ensure that stakeholders are aligned with current radiation safety practices. A. Rely exclusively on periodic departmental memos without direct interaction. B. Institute regular multidisciplinary training sessions and collaborative case reviews involving all relevant healthcare professionals. C. Delegate all radiation safety decisions to a single safety officer without broader departmental input. D. Limit discussions to one-on-one meetings between the chief radiologist and selected technologists. Answer. Correct answer. B. Institute regular multidisciplinary training sessions and collaborative case reviews involving all relevant healthcare professionals. Explanation. Regular, structured sessions encourage a holistic understanding of radiation safety, ensure alignment across disciplines, and foster a culture of shared responsibility. This collaborative approach is integral to maintaining compliance with guidelines and addressing emerging challenges in pediatric imaging. Other options may lead to fragmented communication and do not effectively capture the collaborative spirit required in today's medical environments. Question 19. Taking into account ongoing advancements in pediatric CT imaging, Garcia, an imaging protocol specialist at a renowned children's hospital, is charged with reviewing and optimizing the CT protocols used for his institution's pediatric population. In his role, Garcia examines the current parameters, including KVP, mass and dose modulation techniques, to ensure they align with both clinical indications and ASRT principle. By analyzing extensive patient data and recent technological enhancements, he identifies that adaptive techniques, such as real-time dose modulation, are crucial for tailoring the dose to each individual child's anatomical and clinical needs. His objective is to maintain diagnostic image quality while minimizing any unnecessary radiation exposure. With these considerations in mind, which of the following represents the most effective method for optimizing CT protocols in pediatric patients? A. Using standardized protocols that are independent of patient size or clinical context. B. Increasing the number of detectors to capture more data without regard to dose constraints. C. Employing real-time dose modulation techniques along with adaptive adjustments in KVP and mass based on patient-specific factors. D. Adopting uniform high-dose protocol for all pediatric patients to simplify workflow. Answer. Correct answer. C. Employing real-time dose modulation techniques along with adaptive adjustments in KVP and mass based on patient-specific factors. Explanation. Real-time dose modulation tailors the radiation output to the size and density of the patient, ensuring the lowest dose necessary for diagnostic quality images. This patient-centered approach is fundamental to pediatric imaging and complies with the ASRT principle. Options A, B, and D disregard patient variability and compromise the necessary balance between image quality and radiation safety. Question 20. Under the assumption that every pediatric imaging procedure must be both justified and optimized, Ms. Thompson, a lead radiographer in a bustling hospital radiology department, is tasked with critically reviewing imaging requests for pediatric patients. aware that unnecessary examinations expose children to potential long-term radiation risks and that overly conservative dose reduction might impair diagnostic quality. MS rigorously examines each referral. She collaborates with referring physicians, radiologists, and medical physicists to confirm the clinical necessity of each procedure, ensuring that imaging is only performed when the benefits justify the exposure. By applying the Image Gently campaign guidelines and the ALARA principle, she works to implement tailored imaging protocols that adjust exposure factors based on the individual child's clinical condition. Size. In this context, which of the following strategies best ensures that pediatric imaging is performed only when absolutely necessary and is optimized for patient safety? A. Proceed with all imaging requests to prevent any delays in patient care. B. Mandate pre-procedure consultation with the referring physician to confirm clinical necessity and adherence to imaging guidelines before proceeding. C. Automatically apply blanket low-dose protocol to all pediatric cases regardless of clinical variation. D. Base the imaging decision solely on the immediate availability of equipment. Answer. Correct answer. B. Mandate a pre-procedure consultation with the referring physician to confirm clinical necessity and adherence to imaging guidelines before proceeding. Explanation. Mandatory pre-procedure consultation ensures that imaging is justified, thereby reducing unnecessary radiation exposure. This collaborative approach aligns with both the Image Gently campaign principles and the ALARA concept. It promotes shared decision-making and ensures that procedure is truly warranted by the clinical scenario, whereas the alternative strategies risk either unnecessary exposure or compromised image quality. Question 21. A project manager is using Microsoft Project to track progress on a construction project. A task is scheduled to be completed in 10 days, but due to unexpected delays, it is taking longer than anticipated. The project manager wants to track the actual progress and adjust the remaining duration without affecting the overall schedule. Which feature should the project manager use? A. Task inspector. B. Progress lines. C. Update project. D. Fixed duration task. Answer. Correct answer. C. Update project. Explanation. The Update project feature allows the project manager to update the status of tasks, including actual progress and remaining duration, without affecting the overall schedule. Question 22. A project manager is managing a resource-heavy project and needs to balance workloads among team members. The project involves assigning tasks to multiple resources with different skill sets. What feature should the project manager use in Microsoft Project to ensure resource leveling and avoid over-allocation? A. Resource pool. B. Resource leveling. C. Task dependencies. D. Task type. Answer. Correct answer. B. Resource leveling. Explanation. Resource leveling automatically adjusts the schedule to ensure that resources are not over-allocated, helping to balance workloads effectively. Question 23. You are working on a project where tasks have complex dependencies and you need to create a network diagram to visualize them. Which view in Microsoft Project would you use to best visualize these dependencies? A. Gantt chart. B. Resource usage view. C. Network diagram. D. Calendar view. Answer. Correct answer. C. Network diagram. Explanation. The network diagram view displays tasks and their dependencies in a flowchart-like format, making it ideal for visualizing complex relationships. Question 24. A project manager is trying to determine the critical path of a project. Which of the following views should be used in Microsoft Project to identify tasks that are on the critical path? A. Gantt chart. B. Task usage view. C. Tracking Gantt. D. Network diagram. Answer. Correct answer. A. Gantt chart. Explanation. The Gantt chart view allows you to easily identify tasks on the critical path through color coding and task duration bars. Question 25. A project involves frequent changes in task duration, which could impact the overall schedule. The project manager needs a quick and efficient way to make mass changes to the task durations. What tool should the project manager use? A. Task information dialog box. B. Resource leveling. C. Task inspector. D. Edit task dialog. Answer. Correct answer. D. Edit task dialog. Explanation. The Edit task dialog is the most efficient tool for making mass changes to tasks, including duration adjustments. Question 26. A project manager is required to incorporate a milestone to indicate the completion of a critical phase in the project. Which method is most appropriate for adding this milestone in Microsoft Project? A. Create a new task with 0 duration. B. Use the set deadline feature. C. Create a recurring task. D. Link the milestone to a summary task. Answer. Correct answer. A. Create a new task with 0 duration. Explanation. Milestones in Microsoft Project are typically represented by tasks with 0 duration to highlight important dates. Question 27. During project tracking, the project manager realizes that a task is behind schedule. The manager wants to expedite the task completion. What should the project manager do to shorten the task's duration without affecting the overall schedule? A. Increase resource allocation. B. Set the task constraint. C. Use the task inspector to analyze task drivers. D. Use a fixed duration task type. Answer. Correct answer. C. Use the task inspector to analyze task drivers. Explanation. The task inspector helps identify task drivers and suggests ways to expedite the task without changing the overall schedule. Question 20. A project manager is using Microsoft Project to assign resources to tasks. Some resources are not available for the entire duration of the task. How can the project manager ensure that these resources are assigned correctly without exceeding their availability? A. Use task constraints. B. Use the resource pool. C. Split the task. D. Set resource availability in the resource information dialog box. Answer. Correct answer. D. Set resource availability in the resource information dialog box. Explanation. Setting resource availability allows the project manager to allocate resources appropriately without exceeding their availability. Question 29. A project has several tasks with different types of dependencies. A task is dependent on another task to finish, but it should start as soon as possible. Which type of dependency should the project manager apply between these tasks? A. Finish to start. B. Start to finish. C. Start to start. D. Finish to finish. Answer. Correct answer. C. Start to start. Explanation. The start to start dependency ensures that one task starts as soon as the preceding task begins, rather than waiting for its completion. Question 30. A project manager is managing a large project with multiple teams working on different tasks. The manager wants to identify any resource over-allocations across the teams. Which view should the project manager use to get an overview of resource allocations across the entire project? A. Resource usage view. B. Gantt chart. C. Task usage view. D. Resource sheet. Answer. Correct answer. A. Resource usage view. Explanation. The resource usage view provides an overview of resource allocations across all tasks and helps identify any over-allocations.